Welcome back to the Faculty Factory podcast. I'm Kim Skorupski here at Hopkins, looking at an esteemed guest, Dr. Lawrence J. Appel. Hi, Larry.
Hi, how are you doing?
I'm so glad to have you here, folks. Dr. Larry Appel. He is the C. David Molina, MD, MPH, Professor of Medicine with joint appointments in Epidemiology and International Health and Nursing. He is the director here at Johns Hopkins of the Welch Center for Prevention, Epidemiology, and Clinical Research. You probably know about him. You've certainly heard about the DASH diet, the dietary approaches to stop hypertension. Dr. Appel has spent his whole career looking at conducting clinical, epidemiologic, translational research pertaining to the prevention and control of high blood pressure, cardiovascular kidney diseases, and other chronic conditions, primarily through nutrition-based interventions. And I started learning about Larry's work about 20 years ago when I was getting my certificate in nutritional epidemiology with the lovely, wonderful Dr. Martha Claire Morris, who is no longer with us, at Rush University Medical Center in Chicago. So I read about Larry, and folks, just as a little PS there, Dr. Appel probably at today's recording has over 700 peer-reviewed publications. There's not enough paper to print. I hope you've given up on a CV, and I hope if somebody ever insists on you on giving them a CV, you declined or then had someone deliver the stack of papers. But obviously, as a giant in the world of nutrition and epidemiology and everything else. But guess what? Larry is not here today to talk about that. Larry is so kind and generous despite being so busy writing hundreds and hundreds of papers, because we ran into each other last fall when Hopkins, we offer a number of programs and resources for later career faculty. And we've put together with my colleagues, Dr. Cindy Rand and Jennifer Haythornthwaite, this really fun 3-part series called Next Chapter, the Next Chapter, helping us think about our purpose, our identity, our community, our people. How do we find meaning into the next chapters of our lives? And who walked in but Dr. Larry Appel? And I said, oh my gosh, really? He said, yep, starting to think about it. So that's why he's here today. I said, gosh, would you come and tell your story? Because typical Larry, he's got a great plan. And he shared that in our Next Chapter series. And so he's here to share with the world his plans to think about life post full-time employment. Again, Larry Appel, thanks for being on the podcast.
Yeah.
Tell us your story.
Okay, sure. So I'll make one correction. I didn't start planning my retirement when I started the series. I had spreadsheets that I had made several years before that. It was a process, and it was an integrated process. It integrates not just myself, but my wife and her plans. But a lot of it did have to do with what I would when I was going to retire, and the lead up to that point in time. And I think that I can that many faculty members. The financial aspect is, of course, you have to be careful about, but that really wasn't my primary concern as a faculty member. I was thinking about all of my responsibilities, the grants I led, the grants I participated in, and how I was going to the timing for basically ending for example, my leadership and stuff. So nice spreadsheet. I started off with by year and then by quarter, and now I'm basically about 2 years away from that point where I definitely will retire. I did sign the faculty senior faculty transition program, or signed into that, and perhaps Kim has already discussed that previously. But it's for senior faculty members, School of Medicine, and it sets a date by which you retire. It has to be within 3 years, and you have some flexibility. You can retire before that, but no later than the date. And I said July 2nd. So I have partway through that 3-year plan. on that spreadsheet, I put down every major activity that I have. I'm director of the Welch Center, and actually, I stepped down from that, and that was one of the first things I did. I have other leadership roles, and I decided when I'm going to end those. I decided on what I think is the taper, because you're allowed to decide 80%, 60%, or continue high, or just continue, or just drop down to 30% for, and how I would support myself. So that was the what I think most people try to do is try to figure out, how to transition away from your current job. And I think that's what many people probably focus on. But one of the reasons why I participated in the programs that Kim participates in and leads is the other aspects of retirement. And there are a few things that that I learned, some sort of nitty gritty, and some sort of details. Like, you say you're going to be 60%. Well, what's the denominator? If it's 80% and I'm going down to 50% of 80%, that's a 40-hour work week. That's not much. So, so actually in one of those meetings, Kim said, well, my denominator has to be 40 hours per week. So, so that was an important decision. And my wife doesn't believe I'll be implementing it, but I intend to. So that's one thing. And I think the other sort of things I learned is that even though you're focused, myself, I was been focusing on the taper of work, you actually have to transition into retirement. So a good part of this is thinking about, you're sort of like, you're tapering down, but you actually need to taper up, in terms of other things.
Right.
And and there are several areas that I haven't spent as much time doing. And one of them, I think, is just social, relationships. Virtually, I would say, well over half of my, friendships are through people at work. Right. And, when I, leave Hopkins, I'm going to have to, I think community is really important, incredibly important. And so, reestablishing friendships, creating new friendships, I think is going to be incredibly, is going to probably be the key to a successful retirement. And just to give an example, I got back last week after a 2-week trip to the Amalfi Coast, and did I just go on that trip, but I went with my roommate from college, who I promised I would go every 4 years to a new country with him and his wife, but that never happened. This is the first time. And so that's sort of an example of some of one specific activity, but I think that was a sort of a key revelation to me, is that I really need to not just taper down work, but sort of increase. So, yeah, those are some sort of thoughts that came to my mind as I was, preparing for this chat with you, Kim.
I love it. I love it. Thanks so much for sharing that story. I like the story of the college roommate. Had you been in touch all these years, or was this a cold call? When you
no, it was
like, Larry, call. Who's Larry?
No, he was the best man at my wedding. But and I would see him at college reunions, and I would chat, but it was probably like, twice a year or something like that. So I spent, close to 2 weeks with him and his wife, and of course my wife as well. And so we had a great time. And that was really important, because it was a trip that had no work part of it. Most of the time that I traveled, whether it's in the United States or internationally, I have 4 or 5 days for a scientific meeting, and then I'll add on something. There are no scientific meetings on the Amalfi Coast. So this was pure fun, and it was, except several people got COVID, but aside from that, it was a good start. It wasn't a start. I mean, I hope that, that's that I've actually done quite a bit of travel and often tried to bring family as well. But it was almost always with that scientific conference that was
Right.
the anchor.
Well, I hear two things that are kind of sticking with me. One is that it doesn't appear that your whole life you've been so immersed in your work that you shut out all socializing, because you said you would talk to your college roommate twice a year, you'd run into him at college reunions. So at least you're engaging in some aspect of pulling those relationships forward. So I think that's really important to recognize. And
Yeah.
I'm hoping maybe you'll comment for people who didn't do that, who have not done that, who, because we know people who have just been, their whole identity is their work and they don't have a social life. And I've talked to faculty members, I coach many faculty members who the weekends for them are just depressing because they are not at work. Their whole life and their friends and their is at work. And so when they're
Yeah.
alone, it's very sad. And so the idea for them to transition away from that, that's their whole meaning, their whole purpose, their whole is
Yeah.
so what would you say
Yeah.
to folks who maybe didn't do what you did and find themselves thinking, "Oh my gosh, how can I turn my back on that? What am I walking into a life of isolation?"
Well, I'm not one of those people, and I think you're accurate. I do have friends, but not as many as I think I should have. But I have a lot of interests. Okay, so I read, I read. I have a book every day that I'm reading, at least a chapter or two. And last year I read 20 books. And I love to read 40 books. And I have a list of books I want to read. I'm physically active. I like to run, and so I run 4 to 5 times a week. In the winter, I like to ski, and I don't do that as much as I want. So these are things I'm going to probably escalate a bit on. So my advice I bet you most people have some some activity that besides work that they were really interested in before work. And the big question is, do you want to go back to that, or do you want to do something else? Okay. So, so for me, I've kept up some of these activities, but there are some that I haven't. And I'm thinking, well, maybe I want to play the trombone again, because I played the trombone high school, college, or so I even played in the Ellicott City Trombone Choir for several years. And I'm thinking about starting to play that again. Several years I played the piano, not very good, but I'd like to do that. My wife, that's one of her principal activities. I want to do that. So there are some activities that I think people have that they could dust it off and rekindle that spark that might have been there. But the only way to do that is to actually create the space to do it, and so that I think that the senior faculty transition program is actually useful in sort of setting that timetable. So that's 60 and I'm going to, as of June 1st next month, 80%, and then next year 60%. And I have to be very careful about that time. I think I spoke with you and Jennifer about this, is that you have to make it real, and you can't have creep of work into that space. So my first goal with that 20% is to actually work on where I'm going to live. I'm not sure I don't think I'm going to move out of the area, but our house is too big for a couple of, for my wife and myself. There's a lot of maintenance issues, and of course we can do that, but do we really want to spend our time doing those? Mm-hmm. So that, that 20% is going to be focused on trying to understand where we might want to live, the type of community, and that takes time. And if you're, I do work 50 to 60 hours a week. That means, you can't really do something like that or spend a concentrated period. So that's going to be one of my goals. When it gets to 60%, then I think it's time to really think about, assuming some of those other activities I mentioned, but also spending more time with friends. Yeah, I don't call people on weekdays and as much on weekends as I probably should. That's with people outside of the area, but also getting together with people inside, close by. So I think that's why the taper is so important, is to start some of these, um, relationships, activities that will keep you happy, hopefully during retirement, for those people you just described who have been, in the lab, you know, in dark color, no ventilation, dark rooms, and happy, but they're not going to be happy when they, are home. So
That's thanks again, Larry. I'm wondering, since the first time ever, it sounds, when you went to the Amalfi Coast with your college roommate wife and his wife and your wife, how was that thinking about work? Did you think about work? Did you check your emails? Were you talking about work? Were you reflecting?
it was really interesting. So there are a few things that were really interesting about the trip. People did not talk about work. We did, you learned a little bit, like, there's somebody who, had worked at the CIA, but, you didn't really spend too much time. You say, I told people, I'm a physician, I do research, and they ask some questions, but it really
Then they
was,
don't care.
they don't care that, you're in the Amalfi Coast, what are we, where are we going to go hiking? Are we going to Capri?
What are we going to eat?
Amalfi? Yeah. So, yeah. The other thing, you said email, and I did not check email. I had one vacation, I remember, about 10 years ago, and I did no email for about 2 weeks. And I go, nobody is indispensable. And I have, I work in teams. So there is typically somebody who can cover for me, and keep operations afloat. And so it really, and I was pretty, I set things up so that I didn't leave disasters for people to manage. And it worked out fine. And again, I was, I was dispensable, not indispensable, and of course I'm digging out, having gone through all my email yet, maybe an email from you about reminding me about this. But I did not check email. And I think I think, quite frankly, a lot of people are now, restricting email much better than we did when we weren't, experiencing this deluge. So a lot of people are, they're not checking on the weekends, and they're sending emails, timed emails Monday morning, rather than, sending something where there's an implicit expectation or some, that somebody should reply. So, but anyways, I think that's a key. That made the vacation a vacation and not a vacation/work.
You mentioned earlier that when you mentioned that bad word that kind of made me cringe a little bit, spreadsheets. You said, I had spreadsheets, and I'm sure a lot of people like me who don't like spreadsheets are like, oh man, I got to do a spreadsheet. But when you started, all right, plotting this out like a research study, what's the aim? What are the hypotheses? What are the methodologies?
No, there's no aim hypothesis. There's no aim hypotheses. The columns are easy. It's month or quarter, year. And, I had, one column, July 2026, where there's an R, that's retirement. Okay. And then another row for like the Welch Center. When am I going to end? Which is right about now. Actually, I wanted to end about 2 quarters ago, but then I have another facility that I run, Pro Health, and when that's going to end, I'm PI of one major project or center. When am I going to transfer that? And I've already spoken to the people who are going to take over these, and so those are sort of like the key rows. And then I actually have some things that are just that are sort of sentinel issues, like with this facility that I run. When is the lease up? That's really a defining point about whether that facility will stay afloat or not. Is there a business plan for for that facility to stay afloat. Pro Health, that's the facility I run. You might be familiar with it. So yeah, it just like a master list, and then I clip off the column when I'm finished with that, and it makes it easy. And then one of the numbers at the top is what my effort is: 100%, 80%, 60%, and yeah. So, anyways, it's not a complex spreadsheet.
All right. Tell us, if you will, um, if something's going to go a little wonky or sideways, where do you anticipate? So you just kind of mentioned Pro Health and like the lease. Where might you, or maybe you've already had to monkey around with those spreadsheet values or deadlines or timelines? Because I'm thinking about succession planning. And obviously, someone like you who's been doing this your whole life, you have
Yeah.
to become good at teams and building teams and finding people who lead and have different strengths in different areas. So, in that spreadsheet thought process, how did you find or identify who you'll hand the baton to, and where have you had to make adjustments or kind of pull back or rethink something? Have you had a little bit of whoopsies in there?
Um, some delays, but like the Welch Center took about 6 more months than I thought. But Welch Center is an academic unit; it's highly valued, and so I just said I notified the leadership, who then said they initiated the search process and formal review. My challenge, and it's not a hiccup yet, but it could be, is figuring out who's going to lead Pro Health, which is this offsite clinical research unit that has about $500,000 in overhead every year. And for a long period of time, I have other people that are doing, mostly from the Welch Center in General Internal Medicine, who are doing grants there, but I probably brought in well over half, maybe 2/3 of the grants that kept that afloat. Who is going to do that? And I think it's a valuable resource, but it's also a challenge because it's not a discrete academic unit. It's not a department, and it's not an institute. So that is where the rubber hits the road. But that's also part of the benefit of signing the Senior Faculty Transition Program, because on July 2nd, 2026, I'm retired, whether or not there's a plan for Pro Health or not, and then the can gets kicked up to the people who are still here. Now, I don't want to do that. I really want Pro Health to succeed, so I'm not going to to just wait and let it fall apart. I want it to succeed. That's the headache that I have, and that's what keeps me awake at night. Intermittently, to try to figure out that the complexity of succession for that. Everything else is relatively easy. Another thing that happened that along these lines is people have asked me to get on grants, not because I have a major role, but they like having me on board as sort of like an advisory capacity to help them think through whether it's a clinical trial or helping them get the grant because I have some expertise in an area that is appropriate for the study. But I upfront, I basically say, I'm not going to be around to the end of the grant. I'm retiring, and I will participate in it, but I'm just going to be upfront. I don't want a large role. I'm not going to be in a leadership role. And after about a year or two, you're going to have to find somebody else to run it. So but that you have to start doing almost immediately when you are at that point of, like knowing when you're going to retire. And for me, I did know that when I reached 70, that I want to retire. That has been on the spreadsheet pre-COVID, before any of the challenges that we have now in the School of Medicine. So that was there. It wasn't precipitated by any of these things. That was a fixed time point from about 10 years ago.
70, the golden age for you.
Yeah.
So, Larry, two other things now. I'm curious if I'm sure you have, but how you think about, you mentioned your wife, and how, she was very integral to your deciding what was going to happen, and she's part of this integrative process. How also do you think about the trainees and your colleagues and your early career faculty members who've banked on or are banking on, as an example, the people who want you on their grants? How do you think about those relationships and those careers when you're going to be, kind of
Yep, not as
peace out?
engaged. Um, well, one thing is I think it provides leadership opportunities for the people I lead. So I think that's actually good. That people, have an opportunities to become. I mean, all of these people are independent anyways, but they now one major set of projects is called Resolve to Save Lives, and it every year it comes with about a little over $1 million per year in money to support a variety of really interesting translational research projects. That provides a lot of opportunity. Um, so uh, so I think it's actually quite good for my colleagues. For trainees, I have to be very careful, and I've taken on two master's degree students. I have one DRPH student. I'm not going to take on any more. I've decided because those people will end just about the same time that I read. I don't think it's fair to them. Um, I'll just as an aside, um, the when my mentor Paul Welton left, I go, holy mackerel. He was the one who co-founded Pro Health. He actually founded, I was a fellow at that time. Now I have this large facility, again, close to $500,000. And that was where my research was. So I had to take it over. But, I learned how to do it, and I think that those provide, a opportunities. It's not just science, but somebody who does something like this, they develop skill set that allow them to actually advance. Writing papers and getting grants is one thing, but if you have a major research operation and you can keep it afloat continuously for a period of time, that says a lot, and that would, and that helped me in my career, even though at many times it was a challenge. So I think there's benefit to the trainees and to the colleagues. And by the way, I'm not disappearing. One of the things that we discussed in the sessions you led was, purpose. And so I think I want to work around 25% for a few years, and then it's not leading anything, but it's participating in and helping to think through research issues, maybe help edit papers, stuff like that. And I think those will provide opportunities to still connect, still have an impact, but not as direct as leading some projects.
That sounds like a great plan. And your wife, I want to think about our partnerships and the relationships after retirement. How does she figure into your plans about, obviously you'll be taking her with you when you travel, I hope, and reading all your books and running and skiing and trombone, perhaps piano, and she plays. But do you anticipate spending, more time with her?
Oh, yeah.
Like the day-to-day, do you have hobbies or things that she's already doing outside of the house? Because you always hear the anecdotes of, my cousin said, oh my gosh, what, my husband's going to retire soon. I'm going to have to get a part-time job. And I'm like, I'm confused. Why'd you get a part-time job? Because he's going to be home. And I'm like, I don't get it. So
No, I don't think so. I mean, there are things that not I think both my wife and I have our our tasks that are not tasks, but our activities that are independent. But we also have a lot that we do together. And quite frankly, I think we drive each other crazy if we did everything together. But we have several activities that we do together. We do go for walks and hikes, routinely. And I can't do it every day, but I would if I were home. We read together. We like going to cultural events, whether it's the theater or concerts, which, I do some of, but I could do more of. So there are plenty of things. In all honesty, I am, people ask me if I'm going to be bored. I really am not. I just, how are you going to fill your time? I'm not really worried about that.
One of our colleagues, Dr. Barbara Fibush, who was our Dean for Women years ago, she retired a couple years ago. She told us on a Zoom call recently when we were talking about identity, because we start that next chapter series off with, who, if you're not a professor, a surgeon, a gastroenterologist, an investigator, how do you introduce yourself at a party? What do you say? I used to be, I used to work at, or I'm Kim. How do you introduce yourself? And Barbara shared with the group, it was so great. She said, you know what? People don't care. When you leave academia, you leave your job, people might be like, meh, okay, whatever. They want to know exactly what you said before, Larry. When you're on Amalfi Coast, nobody cares what you used to do. Tell me about your grandkids. Where do you live? Where do you want to eat? What do you do for fun?
Yeah.
What movies have you seen? What are you binging on Netflix?
No, you told me about that comment that Barbara made, and it was so true. You yeah, you might learn where somebody went to college, but you don't perseverate on it at all. You just sort of move on and you talk about, you're going to, Pompeii or Herculaneum, and what you learned there. So it's no, I totally agree with your.
It's a mindset. I think it's a mind shift, because I talked to some faculty members who are, I think, a little anxious about, if I'm not this, then what am I? And it's because we're so accustomed to decades in academia where we are having to have the elevator pitch, to validate ourselves. Who am I? What is your rank? How many grants do you have? Where do you work? Who do you collaborate with? That sense of having to be on, as you're a leader, we do lots of leadership training and how to speak like a leader and act like a leader, and always being on show. And so there is some sense of relief to know that, yeah, people don't care. People just they want ideas. They want suggestions. They want to.
They want a good joke and laugh,
Yeah. It's very comforting to know that that we don't have to have the same expectations. No one will be valuing us. No one wants to see Larry Appel's CV. They wouldn't be able to lug it around. They don't care how many papers he wrote. They'd be like, papers? What are you talking about? Who cares? They don't.
Actually, it's sort of interesting, when people say, "Oh, you're a researcher," and they ask you how many books you wrote. Like, I haven't written a single book. I would never write a book, but it's papers that count. But anyways, that's a digression.
Right. Yeah. So this has really been a great conversation. Dr. Larry Appel, we're so excited to have you on the podcast. This is the kind of the first in the series of exploring the later half of our academic career. And we hope to have you come back maybe in a couple of years. We'll grab you right before that big last column gets deleted on the spreadsheet.
Yeah. Well, the spreadsheet will be over. It'll explode and implode and the computer will die. I have one thing no, this is something that I have in front of my desk at home. And I read this quote, and it is perfect for the phase of life that is pre-retirement. And it's by, famed writer E.B. White. Okay.
Please.
He goes, I arise in the morning torn between a desire to save the world and a desire to savor the world. This makes it really hard to plan the day.
There you go. There you go. Thanks, everybody. Talk to you next time on the Faculty Factory podcast.
Hi everyone, it's your podcast producer with your monthly update. Please make sure to download for free our newest Faculty Factory book, The Academic Medicine Starter Kit, Timeless Tips and Guidance for Early Career Faculty Members. More information on that is available on the facultyfactory.org homepage. In addition to that, I wanted to let you know that as of July 2024, this podcast has had more than 86,000 total downloads and roughly 12,000 total YouTube views. Facultyfactory.org has drawn more than 47,000 total web visits from users in 122 countries. We would love for you to be a guest on our show or simply share the Faculty Factory podcast to someone you think would benefit from it. Please reach out if you'd like to be a guest or to nominate someone in our academic medicine community to be a guest. Simply visit facultyfactory.org and drop us a message.
Thanks for tuning in to Faculty Factory Podcast. The mission of the Faculty Factory is to build and support a community of leaders in faculty development who share tools, resources, wisdom, and encouragement in service to our faculty members, schools, and institutions. We encourage you to go to facultyfactory.org to find out more. Get in touch with me, ask me any questions. Maybe you want to be interviewed on the podcast. Thanks for tuning in to Faculty Factory Podcast. We'll see you next time. The Faculty Factory podcast and website is sponsored by the Johns Hopkins University School of Medicine Office of Faculty. For more information, visit facultyfactory.org.